Commissioners, all the concerned citizens here. When I asked to be on the agenda, and it was last week, and I asked to be on the agenda to speak to the county commissioners specifically about a proposal to save New River. It was a proposal that offered some alternatives, but in any case, we're past the point where that is useful information, so we'll just move on from there. I decided to continue to keep my time on the agenda to do two things. I wanted to speak on, number one, what brought us here. And luckily, a lot of that has already been shared, so that shortens my time quite significantly, which is great. I don't intend on repeating. The second thing is, what are we going to do now? And those are the 2 points that I wish to hit on, and what are our options. I do believe that as Ms. Carter was ready to share, there were 18 days. 18 days, a lot of things have happened. 18 days we were made aware of New River's financial situation. 18 days decided to dissolve it. 18 days we got a replacement and a new plan that's going to save us all. There are 4 reasons that I chose to continue down this road and go ahead and make this presentation. Number one, which I think, and these are all things that are concerns of Allegheny citizens, and I've spoken with a lot of citizens in Allegheny County. We serve the other county. We serve 4 of the other 5 counties that was in the northern region that New River was in. We've talked with other county commissioners in other counties as well, but Allegheny is where our corporate headquarters is. Allegheny is where our heart is, and Alicia Lawson, the owner, grew up in Allegheny, as did myself. So this is where our heart is. This is where we focus. But the 4 things, for the reason for presenting and talking here today. Number one is for saving and or creating Allegheny County jobs in the mental health field. Any job, Commissioner Cox pointed out, just one single job is of utmost importance, especially in our critical time that we're in. The second thing is protecting the mental health services for the folks who need it most in Allegheny County residents. Because New River has been a pillar of this community for 45 years. And for 45 years it has served the folks in the community that nobody else could serve. And it has lifted up and propped up the least fortunate in our community. So it's important, of course, we continue down that road in some way or another, since New River's now gone from that. The third thing is minimizing the amount of taxpayer money that Allegheny has to pay because of decisions that we've made. I've talked to many citizens who have expressed lots and lots of concern about the amount of debt. There's been various numbers that have been out there, and obviously audits and stuff are going to bring this up a lot more. But because of the unique 168 relationship, some of the debts may, as we understand, be transferred onto the counties, and minimizing that would be of utmost importance. The fourth thing is protecting the non-mental health clients at Allegheny County from dramatic changes in the mental health plan, dramatic changes in the mental health of the county. And I'll speak on that just briefly, and what I mean by that is not the effects just in the mental health system. In the mental health system, in the mental health world, we tend to be pretty isolated, and not a whole lot is known. You know, I would bet that most folks in this room before 18 days ago probably didn't even know what an LME was, or who Smokey Mountain Center was, or those kind of things. So it's a very complex process. But the mental health services that are provided in this county are designed to minimize the cost in the jails, to minimize the cost in the emergency rooms, and minimize the costs in other places that are much, much more expensive than community mental health services. So there is an interest of the taxpayer money and also to the citizens of Allegheny County with, that extends beyond the folks that are getting mental health assistance. So with those four things in mind, real briefly, I'll hit what brought us here. How did we get here? September 29th is when Smokey Mountain Center was notified that New River was having trouble paying its bills. The reality is everyone in mental health has had trouble paying their bills the past couple of years. That's nothing new. You can ask any provider across the state. We've had approximately 75% cut in the amount of enhanced services we're able to provide as a Medicaid provider over the past 3 years, since 2008, that is. And about a 30% cut in the amount of money that we get per service provided from Medicaid. So there's been a lot of cuts, and mental health has been a target of some of those cuts. So it's understandable with an agency like New River that a number of their clients were Medicaid clients, that they have some issues paying their bills. New River had more to its story than that, though. That's where, for most providers in the state, the troubles that are money ended. But New River had a couple of things. Reported in the Wilkes Patriot Journal on October 12th, an article titled "Formal Chairman Responds." And this was an article that centered on Zach Henderson, who's the former chairman of the New River Board. He was responding to what was happening with New River at that time. Brought up 3 points that he felt were very important to the demise of New River and how it came about. The first one was New River's expansion in the central region, which it did a couple of years ago at the request of Smokey Mountain Center. Smokey Mountain Center approached New River Behavioral Health Care and said, we need services in these 3 counties in the central region. In general, or to sum up the discussions that happened after that, is CEO Pam Andrews went back to Smokey Mountain and said, we'd love to do that, but there's not enough money. Smokey Mountain turned around and said, but we'll get you the money. We'll support you, we'll give you what you need to expand. Come down to this region. And through lots of debates and debacles and those kind of things through the New River Service Authority Board, as those things go, the decision was made to expand in the central region. Very shortly after that expansion, and after New River expended millions of dollars in employees, in setup, in infrastructure, in buildings, in all the things necessary to expand services in the 3 counties, Smokey Mountain Center didn't live up to its financial obligations and cut the amount of funding that went to New River Behavioral Health Care. So they were struggling. Beyond that, in this year, earlier this year in 2010, those contracts were taken away from New River Behavioral Health Care without an RFP, without a request for services, and given over to another agency. Those were the state-funded services, and a lot of the money that was propping up and allowing New River to continue to exist in a place where it was very difficult. So that happened over the past couple of years. And you can also see from the audits and things I know you guys have reports on, that the past couple of years have been hard for New River. They had lost money both years. Second thing, that New River had a unique hurdle that the other agencies didn't have. The former CFO of New River, Larry Aggers, and I hope I'm pronouncing his name correctly, so I've never met him, but he was recommended to New River Behavioral Health Care to fill an open position by Smokey Mountain. The article in Wilkes Patriot Journal from the former chairman of the board for New River Service Authority.